basal ganglia. In basal ganglia, we will be discussing substantia nigra, subthalamic nucleus, putamen, caudate nucleus, and globus pallidus. These are the structures which forms the basal ganglia. So here we have the caudate nucleus. This is the caudate nucleus. This is the putamen. These are the globus pallidus, externus, and globus pallidus internus. This is the subthalamic nucleus, and this is the substantia nigra. So substantia nigra, subthalamic nucleus. This is the putamen. This is the caudate nucleus, and this is the globus pallidus. Which again is the globus pallidus externus and globus pallidus internus. We will also come across some of the terminologies like striatum and lentiform nucleus. So what is striatum? Striatum, when putamen and caudate are put together, this is called striatum. This is also called striate nucleus. The putamen and caudate are divided by the internal capsule, and it also receives major inputs from the cortex. The lentiform nucleus, when putamen and globus pallidus are put together, then this is called lentiform nucleus. Lentiform nucleus can be remembered by the mnemonic LPG, that is lentiform nucleus made by the putamen and globus pallidus, while the striatum can be remembered by the mnemonic SPC, that is striatum when putamen and caudate are put together, then this is called striatum. So here we discuss when the putamen and caudate are put together, then this is called the striatum. So this is the putamen, this is the caudate. They are collectively called striatum. The putamen and caudate is divided by this internal capsule. The lentiform nucleus, when the putamen and globus pallidus are put together, then this is called the lentiform nucleus. So this is putamen, and this is the globus pallidus. Here you can see this is the globus pallidus, the internal structures, and this is the putamen. So putamen and globus pallidus, when put together, this is called lentiform nucleus. So what is the function of the basal ganglia? The basal ganglia modifies voluntary movements. It receives cortex input, provides feedback to cortex to either stimulate motor activity or inhibit motor activity. What is complex movement? It is the combination of the stimulation and inhibition. For the movement execution, premotor cortex decides to execute a movement. The information comes to the basal ganglia, which activates either the direct pathway or indirect pathway. What will happen when the direct pathway is activated? It will activate the primary motor cortex. What will happen when the indirect pathway is activated? So it will inhibit the primary motor cortex. By the combination of this activation and inhibition, a movement is generated that is called the complex movement or action. The basal ganglia connections. What will happen when you are in rest? So the informations from the pars reticulata and globus pallidus internus, these will inhibit the thalamus by the inhibitory neurotransmitter, which is called GABA, gamma aminobutyric acids. When the thalamus is inhibited, there will be no activation of the cortex, and hence there will be no movement because the brainstem and spinal cord will not be activated. What is the function of the direct pathway? The goal of the direct pathway is to create a movement. The striatum inhibits by GABA neurotransmitter. Which structure they inhibits? Globus pallidus internus and pars reticulata. The globus pallidus internus and pars stops inhibiting thalamus. So thalamus is free to activate cortex. Here are some of the modifiers, that is the substantia nigra pars compacta, which modifies striatum via D1. This is the striatum. When there is activation of the direct pathway, so what will happen? The cortex will stimulate the striatum. In response to the stimulation of the striatum, there will be inhibition of the globus pallidus internus and pars reticulata. When globus pallidus internus and pars reticulata are inhibited, there will be no inhibitory neurotransmitter, and the inhibition of the thalamus will be stopped. What will happen when the thalamus is not inhibited by the GABA neurotransmitter, which was previously inhibited as in case of the resting condition? So the thalamus will now activate the cortex, and when it is activated, so it will execute a movement by activation of the brainstem and spinal cord. What are the modifiers? So the modifiers are pars compacta. What does the pars compacta? This is the part of the substantia nigra. So pars compacta will activate the striatum via D1. Remember, it is D1. The activation is by D1. We will discuss that the pars compacta inhibit the striatum by D2 in indirect pathway. So D1 is for direct pathway and D2 is for indirect pathway. Here it is the indirect pathway. The goal of the indirect pathway is to further inhibit movement. Striatum inhibits globus pallidus externus via inhibitory neurotransmitter, which is GABA. The globus pallidus externus stops inhibiting subthalamic nucleus. Subthalamic nucleus stimulates globus pallidus internus. The globus pallidus internus further inhibits thalamus. What is the modifier? It is against the substantia nigra pars compacta, which modifies striatum via D2. Here it is D2. So here we have the indirect pathway for the inhibition of the movement. So what will happen? The cortex will stimulate the striatum, so it will inhibit the globus pallidus externus via GABA, and there will be no inhibition of the subthalamic nucleus. When there is no inhibition of the subthalamic nucleus, so the globus pallidus internus will be activated, and hence the thalamus will be further inhibited, as represented by this bold arrows. Modifier. What is the modifier? The pars compacta activates the striatum via D2. So when it is stimulated via D2, so it will release GABA, the inhibitory neurotransmitter, which will inhibit the globus pallidus externus, and the inhibition of the subthalamic nucleus will be stopped, and the subthalamic nucleus will activate the globus pallidus internus. The globus pallidus internus will release the GABA neurotransmitter, and this GABA neurotransmitter will inhibit the thalamus, and there will be inhibition of the cortex. So there will be no movement. So here is a summary slide of what we have discussed. Basal ganglia connections. Initially, there is inhibition of the thalamus by the globus pallidus internus and pars reticulata. There is no information to the cortex. There is no activation of the cortex. There is no movement execution. Okay. In direct pathway, there will be the inhibition of the globus pallidus internus. When there is inhibition of the globus pallidus internus and pars reticulata, there will be no inhibition of the thalamus, and the thalamus will stimulate the cortex, and the movement will be executed. What is the modifier? Modifier is the pars compacta, which will stimulate the striatum via D1 receptor in direct pathway. To inhibit movement, that is in indirect pathway, what will happen? That the globus pallidus externus will be inhibited by the GABA neurotransmitter. There will be no inhibition of the subthalamic nucleus. When there is no inhibition of the subthalamic nucleus will stimulate the globus pallidus internus. When it is stimulated, it will release inhibitory neurotransmitter, that is GABA, and it will inhibit the thalamus. Further, the cortex will be inhibited, and there will be no motion. What is the modifier? The modifier pars compacta of substantia nigra, which activates the striatum via D2. Here it is D1, here it is D2. So this is what we have discussed. The pars compacta activates striatum via D1 in direct pathway, and the pars compacta stimulates striatum in indirect pathway via D2. So there are movement disorders which are because of the lesion in the basal ganglia. All these movement disorders result from the damage to a part of the basal ganglia, like Parkinson disease, Huntington disease, hemibolism, and Wilson disease. What will happen in the Parkinson disease? There will be a lesion in the substantia nigra. What will happen in the Huntington disease? There will be a lesion in the striatum. What will happen in the hemibolism? There will be a lesion in the subthalamic nucleus. And what will happen in the Wilson disease? There will be lesion in the globus pallidus internus as well as in the striatum. So in Huntington disease, there will be lesion in the striatum. In Wilson disease, there will be lesion in the globus pallidus internus as well as in the striatum. In Parkinson disease, there will be lesion in the substantia nigra, and in hemibolism, there will be a lesion in the subthalamic nucleus.